Let's welcome Dr. Chang.
Thank you for coming for this special event. I have several mentors here. I feel so lucky I'm in this profession. And today, at the end, I will present several key to adult complex case because we're dealing with a lot of adult complex case. But before I get into my topic today, I would like to extend my appreciation to several individuals. The first one will be Dr. Chang. I was so lucky to learn from Dr. Chang 27 years ago when he gave a lecture about how important to take a record. So I learned from that and decide I'm going to get a good record and start to learn my orthodontic. Hey, I supposed to have 30 minutes instead of 50. And 5 years later, I got a chance to visit Indiana. I was so lucky to become Dr. Robert's first PhD student. And I'm so excited. So I spent my most exciting time, 5 years in Indiana. And I learned a lot. I want to say thank you, Dr. Robert. You try your best to convert an uneducated person to become a little bit educated, not fully educated person. But you did a good job. And finally, I want to say thank you to Johnny. When I finished my study in Indiana, I went back to Taiwan, and I pretty much spent most of my time to play golf. And one day, Johnny called me, hey, you need to study a little bit about orthodontic because it changed a little bit. So I started to go to Dr. Lin's office to join the study club. So I learned a lot at that time, especially those mini schools that Johnny talked about. So far, we've been talking about the ortho implant combined. There are several categories which is so important for us to learn that most adult patient complex case, there are multiple missing. So before you put an implant, you're supposed to do the space redistribution to get a perfect space in order to put your implant. Number two, since we have multiple missing, sometimes you will get elongation for the entire skills. So that needed to be done, especially for the intrusion to get an interocclusal space adjustment. Finally, sometimes we need to do some implant site development to get adequate bone volume and bone height in order to hold that implant. The last category is ETC. So I bet, Dr. Robert, you cannot find number 5. I bet you cannot, even you are a professor. But today, since we have several diplomats already present variety of the first 3 categories, I'm going to give you the last one, which is the crazy one. So let me find a crazy one. Since we are crazy to put an implant, so it will be appropriate for the last case, we take that implant out. So before I give you that case, I want to tell you what I truly believe. I truly believe in case study because I'm visual learner. I can only learn when I see it. When people show me step by step, I probably cannot learn when people just give me theory or principle because I'm not that clever and I grew up in countryside. So what I study case is every case we review and every key step we review. And if we find mistake, we brutal honest to right or wrong because every man make mistake. The man make no mistake, make nothing. So I'm pretty obsessed to make all kind of mistakes. Next one, since Johnny brought up the gummy smile, I'm going to share with you the gummy smile case that I normally treat in my office. And I think that's something that how to connect the dot. Because if you know the implant surgery, the gummy smile correction should be quite easy for anyone who know the implant surgery. How do you solve this gummy smile? Patricia at the age of 25 with massive gummy smile. Would you send her for orthodontic surgery? Let me tell you, orthodontic surgery is not an option. She has no interest at all about orthodontic surgery. She wants conservative. So what will be your treatment plan for this bimacular protrusion? Convex profile. Is that convex profile? Convex profile. Bimacular protrusion. And how would you solve this? Every time I have an endo or have a crown, I'm going to take that out. And that will end up a typical extraction. I don't care. I think the mini screw will solve that problem. So mini screw is pretty good to solve a typical and also the midnight off. And I remember that there is a famous book, I'm going to tell you this story. There is a famous book that published 2 years ago and became the best-selling book in Taiwan for 10 days. Amazing. And it was made by a dentist. And in that famous book called Geology, there are famous collection of speech. They talk about real art is simple. So I'm going to simplify my treatment for therapy for gummy smile within 3 categories. And I hope that everyone in this room will be able to execute that treatment plan. So first is also orthodontic mechanic for gummy smile correction. Actually, it's quite easy because we saw that many times. Let's take a look at 16 months in treatment, and let me blow that up and show you that we use 2 mini screw up front, and you are looking at watch. It's 440 exactly. Don't worry, Johnny. And we use the other 2 mini screw in the posterior. And the upper the anterior mini screw is 1.5 by 8 stainless steel, posterior 2 by 12. With that, and look at carefully the center of resistance for the tooth and for the entire method. And if I were wrong, prove me wrong. Okay. First, when you have a power change, the center of resistance was here for incision. So you pretty much will get an intrusion and you will fray the upper out. So you create a moment, so you fray the upper. And you also have a retraction force. With this retraction force, you have retraction vector. And also, you create a moment. This moment will have an intrusion force. So there are 2 intrusion forces put it together, so you get a massive intrusion for the entire method. And because we have a retraction, the method also retracts a little bit. That's why we solve the convex profile by method protrusion. So it will end up like this. So that is the orthodontic mechanic to correct the gummy smile. And the screw I only use 4 kinds of screw. They are divided into 2 categories. One is outside the root, one is between the root. For the upper anterior I use between the root is 1.5 by 8. The rest of it I use outside the root is big screw. And 90% I use this screw. Only very few impacted I use this screw with hole because for impacted I need level up. Just very few. And the other one is for protrusion or Ramer screw. I use
2 by 14. That's it. The second step is the biology, basic, for gummy smile correction. In order to appreciate the biological reason, let me show you this famous scar. And let me pull it up for you. And I want to tell you, there are 3 lines. It's very important. First is gingival margin. The second is CEJ. Finally is bone level. And from the bone to the CEJ is biological. It was attached by junctional epithelium and connective tissue attachment. So we need to preserve that 2 millimeter biological waste in order to protect the alveolar bone. It's like a protection. So with that basic idea, if we look back and we focus on this area, and then we focus on this treatment, and draw that 3 line for you, it will be a gingival margin, and then the second line will be CEJ. And finally, we have bone level. With that, there are 3 possibilities with the screw to intrude it. The first possibility is you intrude the bone with the screw. That's ideal. But sometimes you might just intrude the tooth. And most likely, you will intrude the bone along with intrude the tooth. So you get a very short tooth. The proportion is not right. So most of the time, you will get this result. This will be, most likely, they will happen like this. So if that happens, what would you solve this problem? Then surgical crown lengthening might be the best way to do it. So let me go through the detailed procedure for surgical crown lengthening from the big gummy smile to small gum. This is post also treatment by pre-surgical crown lengthening. This is post-surgical crown lengthening. And let me show you how we did it. First, we get a local anesthesia with sounding. Sihan, you have to listen carefully. I'm going to do a surgical crown lengthening on your tooth. So, and then you get a 15C blade and make an internal bevel to cut the gum. You always cut the gum before you trim the bone. So before you raise the flap, you're supposed to cut the gum first. Once you cut the gum, you raise the flap, and then you have to look at from the CEJ to the bone. There's not enough space, supposed to have 2 millimeters, so this is too short. So we are going to cut the bone and preserve 2 millimeter biological waste. Sometimes here you get a little bit exoposis when you want to remove the bone to smooth that contour. So you can also use this called number 5 carbide burr. I love this number 5 carbide burr. It just smooths that out. It will take you about 2 minutes and 60 seconds. Okay. So that is the way we contour. We trim the bone, alveoloplasty. We trim the bone around here. We also trim the bone above the CEJ. So we get into, finally, we suture it with 4 or Gore-Tex. And that's post-surgical crown lengthening. And final evaluation for this case. 6th day, we remove the stitch. And 2 months later, the gingival margin stay pretty stable. And look at that crown lengthening effect. Okay, 5 minutes. And the key for intrusion is you need to apply live force in order to prevent root resorption. So you needed to check the x-ray to find out is there any resorption there. And look at that profile. You'll be surprised. Is that the same girl? It looks totally different. And the face getting longer,
And also they have so-called vortex effect. So in order to appreciate, we need to put a same position. When people present the pre-treatment and after treatment, they didn't really position the head correctly. Sometimes Dr. Chang will point out, pre-treatment, they will lift the chin like this, and after treatment, they just put this way. That's classroom correction. So what I would suggest you to do is you draw a line, a guideline like this, from here to the eye. So you'll be able to position pre-treatment posture. And it's so simple because it's built in the keyboard. You just drag it. You only spend about 30 seconds. So use that guideline. Can you believe my mentor, my grandfather? They are the same girl, just orthodontic treatment with simple surgical crown lens. 4 mini screw, which was produced by Newton. Look at that. Is that great? So,
I'll make your next appointment.
thank you. 80% discount. So that's the same girl. I was so amazed. How could that possible that with this simple approach, we be able to intrude the tooth, intrude the whole mess upward, and you look at the superimpose, you'll be surprised. The way we did it is we retract the whole mess up, we intrude the whole mess up, we got into this state. And finally, you look at carefully, you'll be surprised. A couple of years ago, if people show me that you can intrude the whole mess, I would say, you probably did not trace it correctly. But today, I kind of convince myself it is possible. It is possible. If it's not possible, how could this gummy spine become this beautiful, sweet girl? So the reasonable explanation is we be able to use school to intrude the whole mess upward and retract the whole mess. To conclude today's lecture, there are 3 keys for gummy smile correction. Number 1, whole maxilla infection and distillation with screw. Number 2, surgical crown lens is very important to rebuild the biological risk. Number 3, smile training. Just tell the patient, don't smile too big, otherwise you won't look sweet, okay? So, with that, if you can present a case like that, finally, I will encourage you to write up a case and publish in this IJOI with every detailed procedure, which people can benefit from how you fix this case into this stage. And I think this journal can benefit a lot of beginners, a lot of orthodontics. And we also use the DICIE to evaluate our case. But the journal is just our first step. The next step we're going to do is use this journal and transform this material into a 3D ebook. And the next year, we are going to publish the other new book called Adult Complex Case. So far, we already finished so many ebooks. People used to ask me, Chris, how could that possible? For an uneducated person from Taiwan can publish so many. With Dr. Robert's help, and everybody can join this group and publish the best book. You did the possible. You did the impossible because you didn't realize it was impossible. Ladies and gentlemen, I will encourage you to join us and become the part of it to conquer the world. Thank you.